Hello, listeners. This is Kat. Welcome back to Put Your Hands Up Podfics. This will be the continuation of Deku D.O. This will be Part 5, Chapter 5, entitled Candle in the Wind. Recovery Girl frowned as they approached the nondescript alley. A worn-out red awning over a set of heavy steel double doors was the only indication that there was something within. Across the street, the neon sign for an overnight internet cafe flickered and hummed. "This isn't a very safe neighborhood," Recovery Girl commented. "Of course it isn't," Izuku shrugged. "You'll see when we get inside." "Is this your part-time job? I thought you worked at an internet cafe." "Well, I can't tell anyone what I actually do for my part-time job. When I was asked, I panicked and remembered that internet cafe across the street there. It's a little seedy, but my coworkers and I go over there to unwind and play games every so often. They make a mean cup noodle." "So what is it that you actually do?" Izuku let a wide grin spread over his face. "Follow me and I'll show you." Izuku turned to the door, which, despite its appearances, was unlocked, and pulled it open. "Oh, good, you're here!" Izuku was immediately bombarded by his Shift 1 counterpart, Umera Asi-sensei. "I'm late for my date tonight." "Let him in the door, Umera-sensei," Sakuma-sensei interrupted. "We have a guest." "Huh?" Umera looked confused before noticing Recovery Girl. "No way, is that— I'm so terribly sorry, Recovery Girl-sensei. Please pardon my rudeness and welcome to our humble clinic." "Clinic?" Recovery Girl hummed, stepping into the bright lights of the central ER. "You still haven't told her?" Sakuma raised a disapproving eyebrow. "Yeah, well, it's not like it's easy to go, 'Oh, hey, by the way, I work at a semi-illegal underground clinic. Please don't arrest me.'" "You just did." Umera stifled a laugh. Izuku froze. That is— "Don't worry, Sonny." Recovery Girl gave a rare smile. "I figured it would be something of the sort from the context. I may be old, but I'm not an imbecile. You were dropping enough hints that All Might could have put it together." Izuku blushed beet red. "Hey, now that's uncalled for," he pouted. "Anyways, despite the illegality of the whole thing, I think it's wonderful that you found a way to help your friends in a supervised setting. I half feared you were doing medical procedures on your own. Now that I know you're a nurse at a clinic with professionals to watch over you, I feel much better." "Nurse?" Umera mouthed at Sakuma. She just shrugged. Right." Should Izuku try to correct her? Not only was Izuku not a nurse, his supervisors weren't exactly what the general population would call professionals. Well, she would figure it out eventually. If he was going to spill his deepest, darkest secrets, he might as well have fun doing it. "I should probably scrub up." "Go ahead. Oh, and the patient from last night, the one with the abdominal bleed, he's been asking for you," Sakuma added. "He was very pleased to know that all his organs survived surgery." Izuku smiled. "I'm glad to hear it. I'll make sure to check on him first thing. Is he still in recovery?" "Curtain number 2, Sakuma confirmed. "Awesome. While I get changed, could someone fill Recovery Girl Sensei in on what we do here?" "Coward," Sakuma snorted. Izuku shrugged unrepentantly. Me. Takahashi-sensei ran into the room. "Something about Recovery Girl. I volunteer." Izuku almost choked at the 180 from her usual serious countenance. Sakuma just sighed. "She's right over there, you doofus." Sakuma gestured at a bemused-looking Recovery Girl. Takahashi bowed lower than Izuku had ever seen her bow before. "Recovery Girl Sensei, it is an absolute honor. I'm your biggest fan," she began. "My name is Takahashi Shiori Sensei. I'm the attending on shift. Please sign my stethoscope." Izuku face-palmed. "It's very nice to meet you, dear. I'd be happy to." "Takahashi Sensei," Izuku interrupted. "I'm going to go get changed. Would you mind telling Recovery Girl about the clinic while I'm gone?" "It would be my pleasure," Takahashi enthused. "Now, the first thing you need to know is that even though we call ourselves a clinic, we function as something between a community health center and ER. Leaving them to it, Izuku left for the staff locker room. "Hey, Izuku," Natsuo greeted, half-changed, as Izuku entered the room. "Seems like you had an eventful day." "Shut up," Izuku groaned. "I just witnessed an energetic Takahashi-sensei and my whole worldview is shattered." Natsuo just laughed. "By the way, did you get caught sneaking into your dorm last night?" "Nope," Izuku grinned. "The whole thing went smoothly. Then I had to run my mouth, and now Recovery Girl is going to spend the whole night scrutinizing me, and if I mess up, I could be arrested." "Sucks to be you." Natsuo ruffled Izuku's hair. "Oh, and get this. She somehow is under the impression that I'm a nurse." "Wait, what? And you didn't correct her? Oh, this is going to be good. Can't wait for your first surgery tonight." Izuku smirked. "What's the point of sharing a deep secret if you can't do a dramatic reveal?" he joked. "I can't believe I thought you were a sweet little green bean when I first met you. Turns out you're a massive troll." Natsuo rolled his eyes. "Guilty as charged." Anyways, I've got a patient in 3 who needs a strep test. Catch you later. Natsuo gave a lazy wave as he exited the locker room. See you. Izuku quickly changed into his scrubs before heading back out to Recovery Girl. Took you long enough. She clicked her tongue. Sorry, Sensei. I met a friend in the locker room. I'm guessing Takahashi-sensei had to take care of a patient, Izuku asked, noticing that Recovery Girl was alone. Yes, nice girl. Something about a coma patient waking up. For real? That's great! Izuku let out a laugh. I'll have to check in on her later. Anyways, I have a patient I need to talk to, and then I should be good to do some intakes. Is there anything in particular you need to test me on? How long is your shift? 10 hours. You don't have to stay the entire time, of course, Izuku rushed to explain. Then you just take care of your patients as normal, Sonny, and if there's anything we still need to test by the end of your shift, I can come back tomorrow. Sounds like a plan, Izuku agreed. Follow me, the patient is in the recovery room. What happened? Traumatic car accident. The patient suffered significant abdominal bleeding and needed exploratory surgery. Everything went well, he just needs to rest and let his body heal itself now. He was really nervous before the surgery, and he hadn't woken up before the end of my last shift. I see. Recovery Girl made a note on a clipboard, which she seemingly pulled out of thin air. Where? An old woman is entitled to her secrets, Recovery Girl smirked. Anyways, here we are. Izuku led Recovery Girl to the post-op room, and pulled back the second curtain. Hey, Yasui-san, how are you holding up? Hey, the man waved back tiredly, but with good cheer. Much better now, thanks to you. I even have all of my organs still. I'm aware, Izuku smiled, grabbing the patient's chart from the foot of the bed. And I'm glad to hear you're feeling better. I'm sorry I wasn't able to check in with you before the end of my shift last night like I promised. No worries, Yasui chuckled. You must have been exhausted trying to take care of all of us. Obi-san told me what happened, and Ito-san kept me plenty of company. That boy's a hoot. He is rather known for his sense of humor around these parts, Izuku smiled wryly. Well, according to your chart, you're healing up nicely. We may even be able to start you on some solid foods tomorrow. Seriously? Yasui cheered. This is the best news I've heard all day. Now, I'm sure you have plenty of patience and no need to waste time on an old man like me. I'll be just fine. I'll come back and check on you in a few hours. I'm sure you already know, but don't hesitate to page a nurse if you need anything. Yeah, go be a hero, Yasui smiled. I want to take a nap. All right, I'll leave you be then. Sleep well, Yasui-san. Izuku gave the man one more smile before leaving and pulling the curtain closed behind him. You've got a good bedside manner, Recovery Girl commented. It's easy when there's good news, Izuku shrugged. Yasui-san was incredibly lucky. The car accident he was in was a mass casualty event, and despite having a collapsed lung and severe internal bleeding, he got off the easiest out of all of our red tag patients. We ended up losing one of them. I'm sorry to hear that. If their injuries were that bad, why didn't they go to the hospital? They're all quirkless, Izuku shrugged. About a quarter of our clients are quirkless. Another quarter face significant quirk discrimination because their quirks are seen as villainous. And the other 50% of your patients? Half are people who, for one reason or another, can't access medical insurance, immigrants, people with pre-existing conditions, the homeless, and so on. The remaining half are people who come to us because we won't ask questions. Villains, Recovery Girl inferred. Occasionally. They're mostly actually people with substance use and mental health disorders who fear they could lose their jobs if anyone found out. We offer full service and discreet psychiatric care. Sakuma, who you met earlier, is one of our psychiatrists. Sometimes we also get vigilantes or the odd kid who did something stupid and doesn't want their parents to know. But you have treated villains, Recovery Girl pushed. I have, Izuku agreed. And after everything that's happened this year at UA, that doesn't bother you? Of course it bothers me, Izuku responded. But I'll always treat them anyways, because they are people in need of care. Good. Recovery Girl made another note on her clipboard. That was part of the test. Takahashi-sensei already explained all that to me. I wanted to know what your take on it was. I'm glad to see you have your head screwed on straight. Of course she did, Izuku groaned. Well, I'm glad you approve. At least it saves me the worry that some recognizable villain was going to walk in while you were here. Does that happen often? I thought usually the big-name villain groups have their own medical care. That's true, Izuku hummed. But since All For One was arrested, I've somehow ended up as Shigaraki's primary care provider. I'm still not sure how that one happened, and trust me, I am less than pleased. You what? Recovery Girl choked. Not that they know it's me, Izuku reassured. I was wearing a surgical mask and cap at the time, and I guess nobody expects a hero student in a shady underground clinic like this. You don't say, Recovery Girl said wryly. Speaking of, is there something else besides your hero name I can call you when introducing you to patients? Not everyone will be comfortable with the presence of a pro-hero here. Not to worry. You may call me Chiyo-sensei. Great, thanks. Anyways, here's intake in our waiting room. Recovery Girl Sensei, this is Matsumura-san, our administrative coordinator and the only reason the clinic is semi-functional. Matsumura-san, meet Recovery Girl Sensei. Hey, Zuzu Bean. Matsumura greeted warmly. It's nice to meet you, Recovery Girl Sensei. You as well, Matsumura-san. Got anything interesting for us? Oh, yeah. You're gonna love this. Patient in 1. Matsumura handed over the patient file. Izuku flipped it open and promptly choked. Seriously? He gasped. This has to be a prank. Nope. Have fun, Matsumura winked. This better not be surgical, Izuku grumbled. Let's go. Can I see the file? Recovery Girl asked as they walked toward the exam room. Izuku handed it over to her. Oh my, Recovery Girl raised a brow. Now that's not something you see every day. The two soon found themselves in front of exam room 1. Izuku rapped his knuckles sharply against the door. Come in, a feminine voice replied. Izuku opened the door and stepped inside. Recovery Girl followed and shut the door behind them. I'm Midori Izuku, and I'll be taking care of you. With me is Chiyo-sensei, an experienced doctor who's observing me today. Would it be all right with you if she came in with me? Yeah, that's fine, a male voice responded gruffly. A young woman with blonde hair and violet skin sat in one of the room's blue chairs. Across from her, on the exam table, and dressed in a floral patterned hospital gown, was a man with fiery red hair and a full beard. What brings you in today? While Izuku listened to their reply, he made his way over to the sink and washed his hands, snapping on a pair of gloves when he was done. The hue of the man's face was starting to match his hair. That is... Honey, would you mind? The young woman sighed. I'm Fukuhara Poko. This is my boyfriend, Kojima Sato. We were, experimenting in the bedroom and lost our candle. You didn't have to tell them that part, Poko-chan, Kojima hissed. Couldn't you tell them I fell on it or something? Please, because they totally would have bought that. Fukuhara rolled her eyes. Face it, they were going to know. No need to feel too embarrassed. You'd be surprised by what we see here on a daily basis. A candle is hardly the worst impromptu sex toy we've dealt with around these parts. Is it safe for me to assume that by lost it, you mean in Kojima-san's rectum? Yeah. Kojima deflated like a balloon. What kind of candle are we talking about? Izuku asked, making a note on the patient chart and heading over to the patient. Like one of those big round ones, Kojima tried to answer. They're called pillar candles, Fukuhara sighed. It was probably 8 centimeters across and 16 centimeters tall. Izuku paused. Oh my, Recovery Girl murmured softly. That was significantly larger than either of them had been expecting. Right, okay. And how long ago did you lose the candle? Last night. Kojima folded his arms. Because someone was too embarrassed to go to the emergency room until it started hurting, Fukuhara huffed. Izuku paused. It hurts. How bad would you say the pain is on a scale of 1 to 10? Maybe a 4. Okay, well, according to your chart, your heart rate, BP, and breathing all look good. First step in any case of a rectal foreign body is a basic digital exam. If we're lucky, that's all I'll need to do to be able to remove it. Now, I understand that this can cause you to feel embarrassed and vulnerable. If you'd like, I can have everybody but us leave the room. However, if you are willing, I would like Chiyo-sensei to observe. Digital exam? Kojima questioned. He's going to stick his fingers up your bum, you dummy, Fukuhara responded before Izuku could. What? Please calm down, Izuku interrupted patiently. I know it sounds embarrassing, but it is a very common procedure. It's just like a prostate exam. Oh, that makes sense. The man let out a relieved sigh. Now, before I proceed, I just want to feel your abdomen for any signs of infection, especially since you are reporting pain. Is that okay with you? Sure, the man agreed. Okay, please lie down. I apologize if my hands are cold. Izuku gently pressed his hands against the patient's abdomen and started to apply pressure. Let me know if anything hurts. Ow! The patient winced as Izuku pressed over what seemed to be a mass in the abdomen. Izuku quickly removed his hands from the patient. On a scale of 1 to 10, how much pain was that? Probably a 6. And how would you describe your pain? Kinda sharp. No, more like a really bad cramp. Okay, Izuku responded. Well, aside from the clear presence of a mass in your abdomen, which is most likely the candle, your abdomen seems to be fairly normal. Didn't notice any unusual tenderness or rigidity. Given that you don't have any abnormal vital signs, I think it's safe to rule out peritonitis. Peritonitis? It's an acute infection which can occur due to abnormal perforation and requires emergency surgery. Luckily for you, it doesn't look like the candle has broken through the wall of your GI tract. Oh, that's good, the patient responded, somewhat dazed. Now, I'm going to proceed with the digital exam. Would you like anyone to leave the room? Poko-chan, would you mind? No worries, I get it. I wouldn't want you watching my CPAP either. I'll be in the waiting room outside if you need me. Fukuhara gave the patient a light kiss on the cheek before exiting the exam room. All right, could you please turn over for me? Thank you. So basically, what is going to happen is I'm going to insert a lubricated finger into your rectum in order to feel for the candle. You may feel a bit of discomfort or pressure, but there shouldn't be any pain. I know it's hard, but just do the best that you can to relax. All right. Kojima made a noticeable effort to unscrew his face. Izuku wasted no time in beginning the procedure. A few minutes later it was all over. Okay, so I couldn't feel the candle at all, which means it's wedged in fairly deeply. I won't be able to pull it out with my hands. What does that mean for me? Well, first things first, I think it would be a good idea to get an x-ray of your abdomen. After that, I'll have a better idea about next steps. Okay. Great, I'll call in one of our nurses, Azuma Mari-san, to take you into imaging. She's got a magic touch for the cameras, Izuku joked. I'll come back and check on you once we have the results. Thank you, the patient replied. No worries. In the meantime, if you need anything, just press this button over here and one of the nurses will come check on you. If you'd like, we can also send your girlfriend back in here. That would be great, thanks. Izuku shot the patient one last smile before leaving the room, Recovery Girl in tow. You're not going to do the imaging yourself? Recovery Girl asked as soon as they left the room. It's not usually my area in cases like this, Izuku shrugged. Like I said, Mari-san has a real gift for the x-ray machine. Of course, CT scans and MRIs are a different story. Recovery Girl sent Izuku an odd look. The two entered the patient waiting room. Fukuhara-san, you're welcome to go see your boyfriend now. He's in the same exam room. Thank you. The violet-skinned woman jumped up and rushed back toward the exam rooms. Izuku nodded as she passed, and then turned to where Matsumura-san was flipping through a fashion magazine. Slow night? Compared to yesterday, sure. Matsumura responded without looking up. Top file. Patient's complaining of a headache. Bay 3. Thanks, Matsumura-san. Page me when the x-rays for the patient in 1 get back. Sure thing, kiddo. Matsumura flipped the page. Izuku led Recovery Girl back to the central ER, which was much busier than it had been earlier in the shift. Izuku noticed Recovery Girl staring at a group of nurses hanging out around the central desk. What? Izuku asked, nodding at the nurses. There's nothing about wearing pink to be embarrassed about. Recovery Girl motioned at the nurses' pink scrubs. I'm aware, Izuku responded, smirking, so she still hadn't realized he was a doctor yet. Before he could say anything else, Natsuo interrupted. Yo, Izuku, heard you had a fun one, he teased. What did they claim happened? Fall naked onto it, sat on it by accident. Izuku rolled his eyes. Shut up, Natsuo. They were perfectly upfront about the situation, and you shouldn't take so much joy out of our patients' embarrassment. Oh, come on. Take all my fun, why don't you? Natsuo whined. We have to laugh at these types of cases, or we go mad on nights like last night. Did you hear our coma patient woke up? I did. Glad to hear it, Izuku agreed. Now introduce yourself. You're being rude to our guest. Ah, yes. You must be the lovely Recovery Girl. I've heard lots about you from my little bro. You have a brother, Midoriya. Recovery Girl raised a brow. You jerk, Izuku hissed at Natsuo. Who's the troll now? Stop trying to confuse her. No, I'm an only child. This idiot here is Todoroki Natsuo. Todoroki? Recovery Girl repeated in surprise. Like you're one to talk, Zuku, Natsuo shot back. And yes, at your service. I'm the pediatric specialist on shift, though we all also practice general emergency medicine. Natsuo tugged at his lab coat proudly. It's nice to meet you, Recovery Girl responded. I have to say I'm surprised to see you here. I gather your father doesn't know. Natsuo's face darkened. No, and I'd like to keep it that way if you don't mind. That bastard has no right to dictate any part of my life. Recovery Girl frowned, but gave a curt nod. Of course. I already promised Midoriya that I would keep anything I see here confidential. Good. Anyways, I have a colicky infant in room 2 that needs my attention. Have fun with your rectal foreign body case. Izuku made sure to give Natsuo the middle finger as he walked off. Tachibana Kaio-san? He asked, and he pushed back the curtain to Bay 3. My name is Midoriya Izuku, and I'll be taking care of you today. That was a beautiful needle stick, Recovery Girl complimented Izuku as they made their way back toward exam room 1. Thanks, I've had a fair amount of practice, Izuku offered dryly. Anyways, let's see what this x-ray has to tell us. Izuku knocked on the door for the second time that night before entering. Hey, Kojima greeted as the two walked in. Is that my x-ray? It is indeed, Izuku replied, clipping the x-ray to an available backlight and turning it on. The x-ray illuminated, showing a silhouette of what was presumably a large candle pressed slightly past the rectum into the colon. Kojima paled significantly. That's inside me? He squeaked. It's actually not too bad. Barring any other complications, I should be able to remove this non-surgically. Great, Kojima sighed in relief. Essentially, what I'm going to do is insert a tool called an endoscope into your rectum. The endoscope is like a long tube with a camera at one end that should allow me to see the candle. It has a lasso attached to it, so all I need to do is hook the candle and pull it out. It can be painful, so I'm going to give you an epidural, which will take care of the pain and help your muscles to relax. An epidural? Isn't that for pregnant women? Fukuhara-san asked. An epidural is an analgesic that's inserted into the lower spine. It's commonly used for women in labor, but is also used for plenty of other procedures, Izuku explained. That makes sense, Kojima hummed. Do you have any other questions or concerns about the procedure? Not at all, just go ahead and do it. I want this out of me as soon as possible. I understand, Izuku agreed. I'll be right back with the tools I need. As he left the exam room, Izuku grabbed Umeda-san, who was walking by. Hey, do any of the nurses have a few minutes? I need an epidural in room 1. Sure thing, Umeda agreed. I can take care of it. Just give me a minute to drop off this file. Thanks so much, Izuku smiled widely. I'm going to grab an endoscope. Shouldn't take more than a few minutes. Umeda raised a brow. Rectal foreign body? However did you know? Izuku imbued as much sarcasm into that statement as he could. Umeda laughed lightly. Well, go on then. See you in a few, Izuku responded as he and Recovery Girl made their way to the supply room. Endoscope. No, that's a laparoscope. Ah, here we go, endoscope. Izuku cheered as he pulled the flexible tube from its storage box. When he returned to the exam room, Umeda was already inside. Hey, I'm just finishing up with the epidural, she greeted softly. All right, we're all done. Do you need me for anything else? No, that should be it. Chiyo-sensei can help out if need be. Thanks, Umeda-san, you're the best. Just doing my job, she blushed lightly. Anyways, if you need me, I'll be doing pharmaceutical inventory. Can I express how glad I am that I'm not the head nurse here? Izuku joked. Like you could do half as good a job as me, Umeda teased. You'd get too excited nerding out about how cool all the patients' histories are and forget to do your job. Yeah, that's probably fair. Izuku rubbed the back of his head sheepishly. Anyways, have fun with your inventory. I'm sure it'll be more fun than your endoscopy, Umeda shot back as she exited the room. Well, are you ready, Kojima-san? Izuku asked, turning back toward the patient. I'll leave the room again, Fukuhara-san offered, standing up to leave. No, it's okay. Kojima grabbed her hand. I want you here. Maybe just don't watch me during the procedure. Sure, I can distract you by talking about our date plans for next weekend, Fukuhara agreed easily, turning her chair so it faced away from the exam table. All right, Kojima-san. Izuku quickly washed his hands, lubricated the endoscope, and hooked it up to the nearby monitor. If at any time things become too painful, just let me know, okay? Yeah, all right, Kojima agreed nervously. So I was thinking we could try this new Mazusoba place in Hosu that's getting rave reviews. Fukuhara began chatting as Izuku started feeding the endoscope into the patient's intestine. Apparently their pork chazu is to die for. Sounds great. Kojima winced in discomfort. There's also a pastry shop next door that apparently makes a mean yuzu cheesecake, and I know how much you like it. I figured we could grab food to go and have a picnic outside. What do you think? There it is, Izuku murmured to Recovery Girl, being careful not to interrupt the stream of chatter currently distracting his patient. Izuku pressed a button on the handle of the endoscope, releasing a thin wire lasso. Only took him 3 attempts to get the loop around the base of the candle. However, as Izuku pulled the lasso, sliced cleanly through what was now obviously soft wax. Oh, that's not good, Recovery Girl hummed. Shit, Izuku cursed. This isn't going to work. His body temperature must have caused the wax to soften into a semi-melted state. The only way we're going to be able to get this out is surgically. Izuku sighed, unhooked the endoscope, and removed it from the patient. Is it over already? Kojima asked, interrupting his girlfriend who had started to talk about a local fireworks festival they were going to visit. Not quite. Unfortunately, it looks like the wax has started to melt, meaning that we were unable to grab onto it with the endoscope. We're going to have to remove this surgically. Surgery? The patient asked in a panicked voice. It is a relatively standard and low-risk procedure called a laparotomy, Izuku soothed. Essentially, all I'll be doing is making an incision in your abdomen and pulling out the candle. Will it hurt? We'll put you under general anesthesia, so you'll be asleep the entire time. You will probably feel some soreness and tenderness in the area for up to a week after the procedure. That's not too bad, Fukuhara said positively. Is this the only way to get it out? Kojima bit his lip. It's the safest and most efficient. I could try to continue to remove it with the endoscope, but I likely would not be able to get all of it out. Unfortunately, since we're under-resourced, I don't have access to other specialized tools like vacuums which could be used to remove it. All right then, I guess I have no choice, the man sighed. You have a quirk, right? Izuku asked. If you'd like, I could release you to the care of a full hospital. They may be able to remove it non-invasively." "We don't have insurance," Fukuhara explained. "We wouldn't be able to afford a regular hospital." "I'm sorry to hear that," Izuku sighed heavily. "I'll have a nurse come in to prepare you and go over the consent forms." "Thanks," Kojima gave a nervous smile. "And here I was hoping I wouldn't need to scrub in today," Izuku complained as soon as he and Recovery Girl were in the hallway. "At least this is a fairly short procedure." The two started walking toward the OR. "Do you regularly scrub in on the surgeries?" Recovery Girl asked. "That's my primary job," Izuku responded. "Like Natsuo mentioned, due to staffing shortages, we all practice general and emergency medicine, but many of us also specialize." "I see. Wouldn't you be glad to have a surgical case, then?" Recovery Girl asked. "Normally, perhaps. However, last night's shift was intense, surgery after surgery, in addition to the patient you met earlier who needed exploratory abdominal surgery and electrocauterization. I had a difficult craniotomy." "The coma patient?" "Got it in one. GCS7 and a deceptively bad epidermal hematoma. I was hoping I could get a break this shift, but this is just my luck. Anyways, these are the locker rooms. There's a door on the far end leading into the OR. You know the procedure for scrubbing in?" Recovery Girl just raised an eyebrow in response. "Sorry, stupid question. Anyways, there are spare scrubs in the locker on the far right. Scrub in and I'll see you in the OR." Izuku pushed into the men's locker room and made quick work of changing and sanitizing himself. After he tied on his surgical cap, pulled on his gloves, he entered the OR. "Zuku-sensei!" Yoshida cheered, already inside. "How's it hanging?" "Hey, Yoshida-san," Izuku greeted warmly. "I'm doing all right, everything considering. You?" "Peachy," Yoshida made finger guns. "You know what our case is today?" "Laparotomy," Izuku replied. "Patient has a candle wedged in his rectum which has started to melt and can't be removed with a transanal approach." "Fun," Yoshida wiggled her eyebrows suggestively. Just then Recovery Girl entered the OR. "Hello, dear, I'm Chio-sensei. What's your name?" "Recovery Girl!" Yoshida's eyes rounded. "Wait, no, that's your name. My name's Yoshida Nanami. I'm a surgical nurse. It's a pleasure to meet you." At that moment, Azuma Mari pushed into the OR with Kojima sedated on a gurney. "Here's your patient," she said in her usual monotone. "I have him on 70 milligrams of propofol with automatic bolus doses every 3 minutes. "Thanks, Mari-chan," Yoshida chirped. "We'll take it from here." "Have fun." Azuma turned and promptly left. "I can never tell if she's joking or not," Yoshida commented as she pushed the patient to the center of the room. "Okay, are we ready to begin?" Izuku asked, reaching for a scalpel. "Wait!" Recovery Girl shouted. Izuku and Yoshida froze. "I can't believe the two of you. You should wait for the surgeon before starting the procedure. This is unacceptable." Yoshida blinked in confusion. "Pardon? I'm not sure what you mean." "The two of you are very good nurses, I'm sure. But I know for a fact that Izuku isn't even certified. You absolutely should not be cutting into a patient without a trained surgeon present. I shouldn't have to explain this to you." "Nurses?" Yoshida repeated. My bad." Izuku let a wide grin stretch under his surgical mask. "I don't believe I've formally introduced myself yet. My name is Midori Izuku-sensei, and I'm the trauma surgeon on shift." All right, listeners, this concludes Chapter 5 of Deku D.O. Chapter 6 will be next. I hope you all are enjoying this fic so far, and as always, thank you so much for listening.